Okay, let's get to our panel. Joining me here in the studio is Einar Tangen. He's an epidemiologist at the Harvard Chan School of Public Health. With us too is Paulo Sotero. He is with the Brazil Institute at the Wilson Center. And also joining us in the studio is John Sitilides. He is a government affairs specialist and consultant to the United States State Department. Welcome to all of you to the show. Eric, let me start with you. We now have about 200 cases here in the United States, but the death toll so far is very low. What is your assessment of the current situation?
Well, first of all, the death always lags cases because in order for someone to fully capture mortality, you have to wait 6 to 8 weeks. And that's why it will only go up. But also troubling is that we had deaths so soon for the cruise ship passenger as well as in Washington. Like the first weekend we resumed testing, we immediately got a death. What does that mean? It means the virus has already been here for an extended amount of time, spreading in the community, and finally we picked up the death once we resumed testing. So I think we're just capturing the tip of the iceberg.
So Eric, this also points to the fact, something that you told me in the past, that people could have the virus and not show any symptoms.
Yes, that's the other tricky part of this virus. It has asymptomatic transmission. Asymptomatic transmission means even before you feel any symptoms, any cough, cold, fever, you are already potentially infectious and transmitting. This was not true for the old SARS and many other viruses, which means the classic identify, contain, quarantine does not necessarily work because you don't even know if someone's already spreading before you can lock them down.
Paulo, several Latin American countries have reported cases. The first was in Brazil. We're also getting Peru now confirming its first case on Friday as well. How much concern is there in Latin America?
There is concern, but Latin America is used to dealing with those types of situations. In Brazil, for instance, there are 3 confirmed cases, 13 in total suspected cases. I think the systems are ready to go. There is no panic. The tests are available. I think the public health doctors are mobilizing the population, preparing the population in the right way, which is kind of a surprise to us. We have gone through so many of those issues that so far, you know, it's a normal attitude in response. Obviously, as the doctor just said, the cases will go up, and we'll see then how we respond, but they are portraying, the public sector, public health doctors in Brazil are portraying this as one more episode of something that has unfortunately become an annual occurrence.
Right. Do you know, Paulo, if any of the Latin American countries are implementing any kind of travel restrictions?
Not travel restrictions, although the hemispheric branch of the World Health Organization, which is the PAHO, or the Pan American Health Organization, is active, issuing notices, and so it's not for lack of information that things are not happening. People are mobilized, and the response so far has been positive.
Well, Vice President Mike Pence, John, he has been, he's the coordinator of the administration's response to the coronavirus outbreak. He's been talking to the media. Let's listen to what he had to say.
But the American people deserve to know that we are ready, and that because of the President's leadership and because of extraordinary efforts by CDC and Health and Human Services and our partners in state labs around the country, we have the testing necessary to be able to provide tests to all the states that have requested it.
John, before I get to you, Eric, are there a sufficient number of testing kits in the country?
Absolutely not. And especially compared to South Korea. South Korea does 15,000 tests per day. Right. And, you know, that's only the size of California, Oregon, Washington. And every state has said they are really capacity locked. So in certain ways, it's good that CDC has finally relaxed this criteria that any doctor can order the test. The bad thing is that the test kits availability volume from state health labs is low. But at the same time, commercial labs like LabCorp and Quest have finally approved and started offering the test on a commercial basis, and that many states are offering this test without any copay insurance. So we are ramping up, but we are not even close to the almost 100,000 tests that South Korea has run.
And Eric, what is the actual test involved? Is it a swab or blood test? Or?
Yes, it's a swab.
Yeah.
It's a swab of supposedly of your nose and mouth. But at the same time, this test is not perfect. It's it's a PCR, so it tries to test the virus molecule directly. But sometimes, even when someone we know has positive tests, sometimes there's false negatives. Mm-hmm. So positives are for sure positive, but we are missing a lot of false negatives. And people, like for example, last week when we were repatriating the other previous cruise ship passengers, they tested negative, and all of a sudden positive, but they were already on the plane at that time. So this testing is still also imperfect.
Okay. John, we just heard Vice President Mike Pence talking there. What do you make of the administration's response so far to this?
Well, first of all, there's a great deal to unpack here, Anand. And let's just put things in perspective, because there is this near hysteria that seems to be building. And I think it's important, first of all, to remember that in the United States alone, since October, in the last 5 months, 16,000 Americans have died of the flu.
Yeah.
280,000 have been hospitalized. And around the world, 650,000 people will die of the annual flu, and 5 million will be hospitalized. So I just want to put some perspective to this. We're talking here about single and double-digit cases. Not that it's not going to ramp up, but annually we go through very severe flu hospitalizations and deaths. Mm-hmm. So a little bit of a backdrop here just to keep this situation calm and necessarily reassured. To Eric's point about the test kits, one of the things that I find surprising is that for years, if not for decades, through many administrations, we've had other types of epidemics around the world. And I would think by now that not just the United States government, but every responsible government would have contingency plans for the spread of a virus or some other type of an infectious disease, so that we're not caught flat-footed trying to make up for the lack of testing kits. And I wonder what happened at CDC this year, 5 years ago, 10 years ago, to not be ready for this, and for what will come in 5 or 10 years. With Vice President Pence, he's probably the best person for this job in this administration, because on the one hand, he has near absolute trust from President Trump, who tends to trust his family members foremost, and then everyone else on a declining scale. So Vice President Pence has that near absolute trust by the president, but he also carries forth in a demeanor that's very reassuring, very calming, to make sure that we don't get into some type of an emotional terror mode here in the United States over this very serious illness. And he's also doing a very good job because he knows how government should work properly, given his experience as a member of Congress, as a governor, and now as vice president. So if anyone is going to be in charge of this here in Washington, it's a good thing that it's Vice President Pence.
John, one other thing. President Trump signed that $8.3 billion bill on Friday. How does that change things?
I don't know that it changes things immediately. I mean, it takes a while for federal funds to actually percolate into their destined agencies and the like. I think it's also very good for and very reassuring for the public, and especially for state agencies, health organizations, and drug companies to know that there's going to be an abundance of resources available over the next 6 months, 12 months. We'll see where we are later on in 2020, and this may be an annual virus that we go through, and there'll be additional resources. But it's good to have that first significant injection of federal funds. I think, again, one more measure of reassurance that the American people and people worldwide are looking for.
Sorry, you want to say something?
Yeah, I think on the Vice President Pence, I think it's good that he has the ears and trust of Trump and has a very, a good rapport with him. The issue is, first of all, Pence is notoriously famous for previously botching an HIV epidemic in Indiana, which is pretty well established. And secondly, his office muzzling basically the NIAID director, Anthony Fauci, they say he wasn't muzzled, but he had 5 confirmed interviews, and then they were all canceled by the Pence's office. I think that's also troubling, because I think scientists, especially NIH and the CDC directors, now can't speak freely. They need to stand alone, because scientists should lead the efforts in the containment. Science should drive the public policy, not politicians per se.
Okay, John, go ahead.
Yeah, I'm not so sure that we don't have some people in media who are depicting these actions as quote-unquote muzzling and the like. My sense is these are very responsible officials, very comfortable in their professional lives. If they really felt muzzled, they would have resigned.
Yeah.
They're there, they're part of the team, and they're going to ride this out as effectively as they can. So I'm just a little bit suspicious about adjectives that come from people that aren't in there firsthand.
Paulo, go ahead.
No, I think that in this situation, the professionals have to speak. I think the politicians should be quiet.
Yeah.
They don't know what they're talking about. The
Right.
President of the United States has already said a few things that his staff had to walk back. So stay quiet. Allow the very well-trained doctors in some of the best universities in the world to deal with this. They are the professionals that know what they're doing.
Eric, I just want to get back to something that John raised earlier on, and that is the perspective on this outbreak. As John pointed out, we've had thousands of people die from the flu. Mm-hmm. Yeah. Why is this being viewed with such trepidation?
Yeah, there is this argument. It is, it is true the flu does kill a lot more and hospitalize a lot more on an annual basis. Mm-hmm. First of all, this virus has only been only a month and a half since the WHO declared public health emergency international concern. The other thing is, the seasonal flu has an R0 reproductive number, which is for every infected person, how many they infect, right, of only 1.3, which is a very small compared to this one that has between 2 and 4. Mm-hmm. In addition, a lot of people have a baseline immunity to flu, and there's a flu shot vaccine that's mostly effective. For this, we have neither any background immunity, it's brand new, and we have no vaccine. And we have no drugs like Tamiflu to slow it down yet. And again, asymptomatic transmission, yes, 80% of people have mild cases, 20% severe, but this 80% mild, especially asymptomatic, can transmit this at a very high rate. And this is what the potential for this is much higher. Mm-hmm. And I don't want to compare comparisons, and mortality also, there's discussion whether it's 10x higher or not. Let's wait and see, but this is a brand new emerging infection that has pandemic potential.
John, I'll get to you in a moment. Mm-hmm. Paulo, I wanted to ask you about something else in Latin America. I mean, as you pointed out, there's a very small number of cases there.
So far.
There are measures being taken to contain the spread of the thing. But what about countries like Venezuela, which is already having a lot of difficulty, not just in healthcare, in other respects as well?
No, very vulnerable, yeah. Very vulnerable because their health system have collapsed, as well as have everything else. Actually, the impact of this in Latin America, as we know now, comes through the economy, because right, all of those countries are very much connected with China and Asia, and the negative impact that this is having to commerce between Brazil, for instance, Argentina, other countries, and China and other countries there are already projections of lower GDP growth this year because of that. In terms of Venezuela, what can we say? You know, it's a pity, it's a tragedy, it's a self-imposed tragedy, self-imposed by incompetent, irresponsible governments of that country.
John, you want to say something?
I did. I want to take this to other parts of the world as well, in addition to Paulo's comments about Latin America. Yeah. What's interesting is that so far there seems to be a relatively lesser transmission rate in African countries, whereas when this first broke out at November or December, but when we first learned about it in late January, there was a sense that because of the very heavy Chinese labor presence in many African countries, 200,000 to 2 million, there may have been significant exposure, and plus they have very weak health systems in most of these underdeveloped countries, and yet it's interesting that there's been, to date, we don't know how this will play out, a relatively low breakout in many African countries, and then you look at markets such as Italy and Iran, and they've had very significant outbreaks. Yeah. And you start to wonder, what is it about the exposure there? Is there possibly something genetic at play here? And we know so little about this virus. Eric made some very compelling points before. Yeah. We don't know the origin, the transmission rates, the mortality rates, the incubation periods. We still have so much to learn about this as it plays out, and I think this mystery about the virus is one of the reasons that people are becoming increasingly alarmed.
The other thing about the continent of Africa is that there are thousands of African students who study in China, and they travel back and forth between China and African countries all the time. At this point, I want to bring into the discussion Einar Tangen. He is a CGTN current affairs commentator. Einar, great to have you with us. What is the situation in China right now? We know that Wuhan has been the key area where there have been new infections, but has China turned the corner?
Well, you always have to be cautious, but obviously with so many consecutive days of declining coronavirus infections and also a decline in the death rate, people are very hopeful. You can see it definitely on the streets. There are many more people. The restaurants are still not open here in Beijing, but business is returning to normal, even unfortunately, traffic jams.
So when you say business is returning to normal, it's not quite up to 100% yet, I understand.
No, I would say it seems about 70%. That would be my best guess. There are still some factories. A lot of companies are urging their workers to work from home. But China is now cautiously optimistic that the health part is over this. And right now it's all about the economic side. How do you restart a country that has been basically mothballed for 2 months? But, you know, I would have one warning. You know, China was the victim of groups who are trying to take their economic or political agendas and attach them to what is in essence a health emergency. And I think that is probably not the way to go. Trying to do that, trying to blame countries for what they've done in the past or something like that is not the issue. It's the focus should be on what needs to be done now, and are these particular governments responding appropriately?
Eric, when we look at whether the situation is getting better, what we're looking at is a lowering of that infection rate number that you talked about, right?
Yeah, right now it's in the United States we have very obvious exponential increase. Yeah. I would like to see that slope become more linear rather than exponential and hopefully flatten. The other big question is, you know, we have to incentivize people to get tested, because testing without a vaccine or antiviral drugs, containment in terms of contact tracing and then quarantine is the only countermeasure besides social distancing of canceling school, canceling big events. And in order to do that, we need to have everyone come forward to be willing to test it. And I have worries because sometimes, you know, in America, we don't have paid sick leave, and many low-income hourly workers, you know, if they get quarantined, they lose half a month's wages, as well as everyone around them.
We've also had some people being charged astronomical sums for tests.
And so, and right now we don't have this nationwide waiver. We only have Massachusetts, you know, New York, Washington, California that has waived insurance copays for this. Other states have not, and that there's a big disincentive in America to get tested for economic reasons. Yeah. And I'm worried.
John, the other thing, of course, is that this crisis is happening in a very big political year, as we're seeing all around us all the time. And, you know, the handling of this by the president, by the White House, has become very politicized. You've heard some Democrats, they're criticizing Vice President Mike Pence, who is in charge of the government response. That's a risk, isn't it?
It is, and there are several interesting ways this may play out, both tactically and strategically. I mean, tactically, what happens with President Trump and with Joe Biden and Bernie Sanders? I mean, they'll have a contest for at least several weeks. And for instance, political rallies. President Trump can get 10 to 15,000 people in an auditorium, in a stadium. Are they going to risk this? And will people come and attend? And then you even have some very snarky commentators who say if they get sick, they're going to go to the other parties' rallies and infect as many people as possible. I mean, this kind of demented thinking. But on a strategic level, you start to wonder, because we don't know what the transmission rates look like, and if this does become more linear, I like the way Eric described that over the summer months, but comes back in the fall, does it affect the election process? Right? I mean, things that we have to think about, if we don't want to, but we'll see what happens come the fall. But the rallies, I think, are going to be affected by this in the weeks ahead. And that'll be to the detriment of the president's strategy, because it has been such an effective political communications platform for him.
Yeah, in fact, we just heard one of those big festivals that take place every year in Texas, in Austin, South by Southwest, just been canceled.
And Comic-Con as well in Seattle.
Comic-Con being canceled, Einar Tangen, how crucial, in looking at the Chinese experience, was it that China locked down Wuhan very early and also put an entire region in quarantine in controlling the spread of the virus?
Well, it was absolutely crucial. You know, prior to this point, the idea that you could do social distancing was not something that most experts thought was even possible. China had the tools and the ability and the willingness of the people to actually follow these directions. Most of my Chinese friends do not go out of their homes except to shop. They're not going out to restaurants. They're not going out to clubs. They will go out for a walk, but they will not go out and mingle in large crowds. This is the exact opposite of what Donald Trump is wagering his presidency on. He really believes that somehow coming out to a rally for him will make everybody safer or is for some reason immune. But here in China, they're very, very clear. It's not about the political process. It's really about the health safety. There are so many measures. My compound is wiped down twice a day overall. The keys to the elevator, door handles are wiped down every half hour. There's plastic everywhere where you would touch anything. And you're issued a card that indicates exactly where you have been. Not exactly, but it gives you 3 different zones. 1, green, clear, you've been in Beijing for 60 days. Yellow is cautionary. They'll ask you to stay in your house for a few days. And red is basically you need to stay in quarantine for 14 days. And everybody knows this because it's checked at the entrance and exit when you leave your compound. Now, some people say that this is a violation of political rights. From the Chinese perspective, this is the government working effectively to control a massive viral outbreak.
Eric, we've had several people from a nursing home in Washington State who have died. Are older people a lot more vulnerable?
Yeah. Well, the mortality, for sure, the mortality in elderly is much, much higher, exponentially higher than young people. But in terms of severity, there's, besides mortality, 20% of people have a severe disease, and WHO says those people will have 3 to 6 week disease duration. In some of the papers, we've actually seen that just as many young people under the age of 60 were in ICUs as the elderly. Obviously, they survive more, but the fact that you have so many people, up to 20%, who need ICU or at least hospitalization is a real concern. And again, in China, they had many doctors who are 29, 34, 42 die. And these are pretty young, healthy doctors with the best access to medical care. So young people are not immune. But at the same time, I think the 80% who have mild cases, that's the other risk. They keep socializing and contacting people and exploding the number of people.
Paulo, very quickly, I've got about 40 seconds left. As we've been saying, many big events are being cancelled. Others, we don't know what the future is going to be. Of course, the big event that's going to take place this year is in Japan, which is the Summer Olympics. The IOC is expressing confidence that the Games will go ahead as scheduled, but what do you think?
Well, I think if they have information that it would not be safe to proceed, they would suspend it and postpone it, which would be the right thing to do. And in the meantime, what we all have to do is to listen to our mother's advice and wash our hands with water and soap all the time.
Good advice. That's where we have to leave it. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Have a great weekend, and thanks for watching.
In-depth stories.
All the coal that was mineable is gone.
As the days and weeks went by, a lot of innocent Iraqis were killed.
So this is my home. This is my home. This is the only place I know.
And this is why we think AI tutor could stand out.
That begins to shake the foundations of the global order.
Big Story, weekly documentaries.
Hello everybody, I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week we take a deep dive on world headlines, talking to experts, journalists and others. It's a fresh, focused and intimate look at the issues that matter most. Whether you're at home or on the go, you can find the Heat podcast just about anywhere podcasts are found. Have a listen today and subscribe. Thanks.